Hey, it's Dr. Meyer, and today we're going to talk about what the 34 symptoms of perimenopause are. So I bet you didn't know there are 34 symptoms of perimenopause and probably more, but what I'm trying to highlight here today is that it is not always just hot flashes. That's the end stages. There's a lot of things that happen along the way that women may not recognize as signs of their hormones changing. So check out today's video to learn more about that. So welcome today. We're talking again about the 34 symptoms of perimenopause. And I'm Dr. Shelley Meyer. Welcome if it's your first time. Welcome back if you're coming back. I so appreciate your support. And please remember to like, subscribe, and share so that this channel can grow. I'm a functional medicine doctor, family doctor, and registered dietitian. So I talk a lot on this channel about gut health and hormone health and even metabolic health as well. And in my practice, Highlands Health and Wellness, I work with women every day on perimenopause and menopause symptoms. And so I've been focusing on gut health lately on the channel. So if there's any things you want to check out there, there's lots of playlists there. But in the past, I have focused on hormone balance and perimenopause. So I'm revisiting that because it comes up so much in my day-to-day practice. So what is perimenopause? That's the stage. It's not menopause. Women think it might be the same as menopause, and men might think that too, but it's not. It's the years leading up to menopause. Menopause is actually just one day that happens 12 months to the day after your last period. Perimenopause is everything leading up to that. Now, you can have perimenopause symptoms as early as your late 30s. It's more common to get them in the early 40s, mid 40s, even late 40s. But you can have them as early as your late 30s. So it's good to start learning about that now because it's not talked about nearly enough in your doctor visits or even online. It can be confused with menopause, and it's not the same thing. And be sure to stay tuned for next week's video where I'm going to talk about the stages of perimenopause. But today let's talk about what the 34 symptoms could be. Well, one is kind of obvious: irregular periods. We may think of menopause as the day of the final, a year without a period, but irregular periods happen in the years leading up to menopause. So that is in the perimenopause time frame. So you can have a period, let's say you've been a woman that has one every 28 to 30 days their whole life, and then all of a sudden it starts going every 6 weeks, every 8 weeks, and then it's every 1 week or 2 weeks or something like that, where it just shifts all the time. That could be the early stages of perimenopause. Don't confuse that. Let's say you're in your 20s or early 30s. Don't confuse that with stressful times in your life that can make your periods be a bit off. This is a continued pattern of irregularity. And of course, always visit your doctor or a healthcare provider if you're concerned about the heaviness of your periods, the infrequency. If you think you're pregnant, take a test. There's all those things to think about. But know that if you're in the most common age range I talked about for perimenopause, that could be the cause. And then weight gain is another thing. I hear about this all the time, and I've experienced it myself. So right around that time frame, when did mine start? Perimenopause, probably like early 40s, mid 40s. I started to gain weight, and I work out quite often. I, eat well, relatively well. We all have our bad days, but I was doing all the same things that I had always done in my 30s, in my 20s, and I was gaining weight. And I was doing all the things I used to do to try to lose weight, and I wasn't losing the weight. So don't get frustrated. I'm sure you will get frustrated, but understand that it's normal. I don't think you should just sit down and accept it, but there are ways to adjust, to work on the hormones, to try to get a handle on that weight gain. And it can vary. About 80% of women experience some kind of weight gain, and it can vary between, a couple pounds, 2 pounds, I've seen all the way up to like 20 something pounds. And there are other factors that can factor in, of course: thyroid, cortisol, stress, lifestyle factors. So I always work with my patients individually because there's no one prescription across the board or one reason across the board that's going to cause that weight gain for everyone. But know that weight gain can happen. Generally, it's that kind of belly weight gain around the middle region that can happen with perimenopause. Hot flashes. So those are more in the late stages of perimenopause. So I'm going to talk about those stages next week, but that's more so when estrogen starts to drop and the progesterone drops in the beginning, and I'll talk about this more next week. But when the estrogen starts to drop in the later stages, that's when you start to get more hot flashes. But they can happen, and they can happen in the daytime, they can happen at night, different from night sweats, which can also happen where you're drenched, but you can also just have these flashes of feeling hot too. Insomnia, that's the one that drives me crazy and that I see in a lot of women, is that, 3 to 4 a.m. wake up call every morning. You're waking up, you can't fall back asleep. That is one of the major signs of perimenopause. Night sweats, I talked about before. Trouble concentrating, that's one that is not talked about a lot. And women may think, oh my gosh, I have adult onset ADHD, which maybe you do, but it can be the changes in your hormones contributing to trouble concentrating. Headaches are another issue I see. The progesterone drops. Sometimes when we supplement progesterone, if it's safe for you, it's not safe for everyone. That can help headaches. Sometimes we can work on headaches with herbal support, or just working through stress and meditation and better sleep. But headaches can come with perimenopause. Brain fog. I've talked about that a lot with gut health. It's also with hormone imbalance. So the hormone stages and imbalances that happen with perimenopause can cause brain fog. Dizziness is another one where, that could be other things. There's so many causes of dizziness or potential causes of dizziness, like blood pressure changes, or if it's too low or too high, or inner ear problems. But these hormone changes can contribute to dizziness. Heart palpitations is another one. So that's when your heart is beating irregularly. I can see that sometimes with perimenopause. Sometimes it has to do interrelation with, or relates to basically cortisol and thyroid, which those can get a little bit off during perimenopause too, because all your hormones need to come together and kind of play like a very well-tuned symphony. So those things can relate. So it's good to see your provider and parse out what might be the cause of that. Mood swings is another cause of perimenopause. I mean, another cause of perimenopause, another symptom you see in perimenopause. And that is a very, very common one where, that estrogen will surge like in the first stages of perimenopause. And then you will have your mood just you'll be a shorter fuse with your kids, with your co-workers, with your friends, with your husband, wife, whatever. You can have a shorter fuse when you're going through those stages of perimenopause. And you can also feel really depressed all of a sudden, really sad. So those are things to look out for. Anxiety, depression are two of the other symptoms, that kind of two different ones, but those can happen. And women often get prescribed antidepressants, or antidepressants for anti-anxiety, but really it could but it could be the hormone imbalance, and really working on that as a root cause is very important. If you're liking this, I'm only halfway through, or not even, I don't think, I'm on number 14, but if I'm only part of the way through, but if you're liking this, please leave me a like and subscribe to the channel. I will also have a free PDF available on different ways to test your hormone levels for perimenopause, so be sure to check out the description down below, and we'll get you linked up to that free PDF. I have lots of other cool free PDFs available once you join my email list too. So let's get back to it. So along with anxiety, you could have panic. All of a sudden have panic attacks, which are very severe forms of anxiety. Sometimes women will end up in the ER with chest pain, with heart racing, with unable to control their thoughts, heavy breathing, rapid breathing, feeling like they're going to pass out. That could all be related to perimenopause. Irritability, so kind of goes along with the mood swings, or the other hormone imbalance symptoms I was talking about that affect the mood. But irritability could just be the one thing that you have. And granted, there are lots of things in life that can cause irritability, but it can be those hormone shifts. Low libido, so we see not only the testosterone can sometimes be affected in perimenopause, and women do need a certain amount of testosterone, but also the estrogen and progesterone shifts can contribute to low libido. You'll see vaginal dryness, so you could have pain during sex because it is so dry in the vaginal area, and that could be more so in the end stages of perimenopause in those last couple of years, but that can be from the low estrogen. Along those same lines, stress incontinence, if that tissue gets well, not necessarily related to that. That's more so with the dryness, but along the same lines, in the same general vicinity, you can have bladder issues and stress, incontinence. Digestive problems, so you could have unexplained bloating right around here. The abdomen gets bigger, not just from weight gain, but water retention, and that can happen from hormone imbalance as well. And then the other digestive, so bloating is one of them. And then the other digestive problems you can see are the changes in the microbiome. You could see a dysbiosis and imbalanced gut microbiome, and that could be associated with hormone imbalance with perimenopause. And I do a lot of testing for microbiome imbalance, so you can check out my Rupa lab store if you want to check out, or any of my gut health playlists, and you can actually check your microbiome there and learn about it in the playlist. Joint pain, so some women will have a tendency toward osteoarthritis or joint pain, and that can get aggravated in the years leading up to menopause. Along those same lines, you could have muscle tension, you can have more pain in the muscles surrounding your back, your neck. That can contribute to the headaches. So that's something to think about if that happens in the age range that we're talking about. You can also have some excessive sweating from the heat, from the low estrogen. That's more in the late stages, and then your body odor could change. So that may be a less common symptom that can happen. Hair loss. This is one I hear women complain about every single day. So I have experienced it too. I have thin hair to begin with, and then having that hair loss with perimenopause was not fun. So make sure if you're having that experience that you get checked out. Is it perimenopause? And there's not one test for perimenopause. I'm going to talk about that in future videos. So you need a doctor who's experienced with hormone balance. But also, when you're having hair loss, make sure to check your cortisol and your thyroid too with an experienced hormone doctor. Number 26 I'm up to now, brittle nails. So your nails could get weak. That could be from the hormone changes, from the gut imbalance that goes along with perimenopause, but weak nails can be a sign of perimenopause as well. So sometimes food also, this is number 29. No, sorry, I skipped ahead. 27, itchy skin. So that happens to me a lot, and I can get very itchy skin. It has to do with your collagen production and your lower estrogen levels towards the end stages of perimenopause. Burning mouth I have seen occasionally. I don't see that very often, but it's very tender around the mouth and tongue and cheek and lips. Also to do with the changes probably towards the later stages of perimenopause. So sometimes changes in taste when your estrogen drops. This is number 29. You can have more of a bitter taste in your mouth. Now that can come from dental problems. That can come from zinc imbalance. There's a lot of things that can contribute to bitter taste in your mouth. So don't just chalk it up to perimenopause. Get your nutrients checked out as well. But it could be the estrogen dropping. Bleeding gums, same kind of thing. Towards the end, when the estrogen does drop, you can get bleeding gums. Now, the mood stuff I talked about and the brain stuff can be when estrogen drops, but that can also be towards the beginning of perimenopause stage when estrogen is like spiking and going, like becoming estrogen dominant. So there's some things that can carry over between both sides, but more of these most recent ones I mentioned can be more towards the end. Some women will feel tingling extremities, so it's almost like a neuropathy. They'll feel where their fingers may tingle, their toes may tingle. So keep an eye on that. That can sometimes be a B vitamin deficiency and not related to your hormones, but that's why it's good to get that free PDF of mine, to see your provider and get levels checked to make sure, is it your vitamins, is it your minerals, because zinc can do that too, zinc deficiency, or is it perimenopause, or one of the other things like diabetes that can contribute to tingling extremities. Electric shock kind of feelings. I have heard women explain that as like a snap or a buzz in their head, a quick electric shock type feeling. That one's not very common, but something to consider checking out if you feel that, because there can be other symptoms of that may not be related to your hormones, and it is important to get that checked out. And then number 33, we're almost done, would be osteoporosis. So about half of women over 50 will have osteoporosis or osteopenia, where you're leading more towards osteoporosis. So this is probably not going to happen until your later stages, perimenopause/menopause. We usually don't check bone densities till over age 65. But, if you feel like you've broken bones more easily or you broke a bone more easily than you should have, it runs in your family, it's definitely something to talk to your provider about. And then the final one, number 34, would be increased allergies. It's not necessarily that common, but we can see allergies happen during this stage of life that you've never had before. They could be seasonal allergies. Maybe you need more allergy medicine than you used to. Maybe you have more allergies than you used to. Maybe you never had allergies and now you do. Or maybe you have asthma symptoms. We can see that when estrogen drops because estrogen helps play a role in inflammation. So those are the 34 symptoms that can happen. I have seen other things happen as well, but that's a place to start. Be sure to check out my free PDF. I have a bunch of prior videos on hormone imbalance, like estrogen dominance, which is the first stage of perimenopause. And then I have some other videos on perimenopause itself and more to come. So thanks so much for joining me. Make sure to get that free PDF. If you want to check your labs, any of the hormone kits or the gut microbiome kits, check out into the description my Rupa labs. And thank you again for being here. I'll see you next week and we'll talk more about hormone balance.